Hello, I'm Alan Weil, Editor-in-Chief of Health Affairs. Thank you for joining us today. The December 2022 issue of Health Affairs features several research articles that explore the relationship between income and health, in particular, how government income supports affect the ability of low-income families with children to achieve health. All of the research presented today was funded through the Robert Wood Johnson Foundation's Equity-Focused Policy Research Program. Now, the relationship between income and health is actually quite complex, and it's bi-directional. But behind all of that complexity is a quite simple fact. Families without adequate income experience poorer health. They're less likely to have access to basics that enable a healthy life, things like decent food, outdoor space, a safe living environment, educational opportunities, and they're less able to access needed health services when they're required by the family members. There are various government programs that provide a financial safety net, but access to them is not entirely equitable. And so these programs, as important a role as they play, can also exacerbate health disparities. In today's event, we're going to discuss the programs. We're going to discuss some of the disparities in eligibility and participation, and what we can do to try to reduce these inequities to achieve a more equitable health outcomes. We have an excellent set of policy leaders and researchers joining us today. The way our time will go is as follows. We'll begin with a panel of some policymakers and thought leaders who will set the stage by looking at the broader topic of access to income supports and the relationship to health, and talk about some of the things we might do. We'll then move to presentations of the individual papers that appeared in the December 2022 issue. Each author will have up to 7 minutes to present their findings, and we'll then have some time for question and answer. For both of these panels, you are encouraged, if you're watching us live, to submit questions through the Q&A button at the bottom of your screen. Those questions will come to me. We'll not answer them live or online, but I will do my best to integrate them into the conversation. Questions that are submitted on the earlier side, that are of general interest, that are short enough that I can read them while I'm also moderating, those are all more likely to make their way into the conversation than ones that come in at the last minute about something that is likely of interest only to the questioner. So please feel free to participate. I'll do my best to bring you in. Before we begin the program with our two panels, it's my pleasure to introduce to you Jennifer Nandu, who will provide a few words about the topic of the session today. Ms. Nandu is the Managing Director over the Healthy Children and Families Program at the Robert Wood Johnson Foundation. She helps lead grant-making activities designed to ensure that all children and families have the full range of opportunities to lead healthy lives. She spent 10 years at the National Council of La Raza, where she oversaw efforts to advance the organization's health and civil rights policy projects. We're grateful to you and the Foundation as a whole for support of the issue. It's now my pleasure to turn it over to you to say a few words about why this is such an important topic.
Good afternoon, Alan, and thank you to you and the Health Affairs team for this kind invitation and for using your platform to elevate why we need to make the United States a more healthy, equitable, and more just country. As Alan mentioned, I'm Jennifer Nandu, and I am the Managing Director of Robert Wood Johnson Foundation's Healthy Children and Families Program. And as part of RWJF's vision to advance a culture of health grounded in health equity, we hold a goal, one that is generational in nature, to support the economic inclusion of families so that they can achieve well-being. At RWJF, we believe that this requires us to identify, understand, confront, and remove the structural barriers to health and well-being. And those include racism, powerlessness, discrimination, and the resulting consequences of those things. Together with our grantees and our partners, we work to address inequities that are historic and built into the very foundations of our current economic system. And as a nation where indentured servitude and slavery were core parts of how we started our current economic system, we want to build systems and support systems that recognize that it's been hard for families to stay together and to achieve the resources that would enable health. And thus, we have thought it so important to bring these strands of economics and health together. Philanthropy can always play a significant role in supporting social change. But we think it's particularly important in this time where we are considering who we are as a country and our identity, that we think about imagining new systems and supporting efforts that think about what could be and should be. This is why we felt it so vital to support the efforts of the Equity Focused Policy Research Initiative that is the foundation of this special issue. We know that poverty and the systems and structures that contribute to it have are a major structural barrier to health. And research like this, bringing fields of practice who are going to be the biggest innovators of this work, are really essential in helping us to figure out how to get there and how to address these roadblocks to well-being. As I mentioned, we know that there are major barriers that are structural in nature to well-being. And we also know that because power, because discrimination, because racism are present in our society, the stories of those groups who are often most affected by the set of factors like income that hinder good health, that they are often not represented well in research. We also have underrepresentation in our scholarship, from BIPOC scholars to women scholars to rural scholars. And so the platforms that elevate research, the research that is reflective of our society, are deeply important. As they say, bringing things into daylight, sunlight is the greatest disinfection. This work is part of a larger effort. And while we acknowledge that research is vitally important, it is all in service to transformation. We think about that transformation as a need to look at the social contract and to build a new one that brings in families and children something that really did not happen in the first place, one that actually recognizes our interdependence and the shared prosperity that we need to have as a nation. As a wealthy nation, we really do have enough for everyone, but we haven't always invested it in the right places. So we are so excited to be here. We're so excited to pull through this topic. And I'll just end with a story about why being here and having this conversation is near and dear to my heart. I know the power of income supports personally because my mother often accessed the earned income tax credit as we were growing up. It was a vital infusion of cash at a part of the year that helped me do the things that I needed to do, whether it was get my school clothes, make sure we had healthy foods on the table, buy clothing so I could participate in sports activities, and ultimately be the healthiest, most vibrant child. And I understand the importance of how we think about these programs in families' lives. They are imperfect. There's work to do, but they are a reason to understand how we can meet that social commitment to children and families in our nation. So what I will say in closing is, while there is a long list of folks to be grateful for standing behind and backing this work, I wanted to give special gratitude to Gina Hajawi. She's a senior research officer at the Robert Wood Johnson Foundation, and she will shy away from the acknowledgement, but in her humility, she has been a persistent and fierce voice behind the scenes. She has not only been anchored in the vision that we must do all that we can do in our respective positions to bring light to health equity. She exemplifies the principle that when we do better, we do better. So thank you to Gina. Thank you to the brilliant minds and voices who are joining us today and who have agreed to be a part of this effort. And I look forward to being with you all today. Thanks.
Thank you, Jennifer, for those words that touched on so many important themes. And I'm grateful to you for sharing those many thoughts. I do want to say we are making every effort we can at Health Affairs to bring voices into the health policy discussion that simply haven't been a part of it for too long. And this is a part of that initiative and endeavor. And I'm pleased to be able to do my small part in furtherance of that goal. But you said it better than I. So probably better for me now to move to our first panel, where there are others who've been working in this field who will bring perspectives that we need to hear and understand in order to improve policy, to improve health and health equity. So let me go ahead and introduce the panelists in our first panel. Renee Boynton-Jarrett is an associate professor at the Pediatrics Chobanian and Avadisian School of Medicine at Boston University. I'm sorry if I got the names incorrectly, but at BU. Jessica Fulton is the Vice President of Policy at the Joint Center for Political and Economic Studies. And of course, you have heard from Jennifer Nandu from the Robert Wood Johnson Foundation. So since Jennifer gave the opening, I think I'll turn to the other two of you to just give a few minutes. I think it's very helpful for our audience to understand a little bit of where you come from, if you will, what perspective you bring to this issue, and what you think are some of the most critical elements for our audience to think about as we try to improve the role that income support programs play in delivering a more equitable and just health system. And then we'll go much more deeper than that. But just to start off with a bit, Renee, if I could turn first to you.
Thank you. I'm so honored to be here. Thank you for that wonderful introduction, Alan and Jennifer. Thank you for your powerful remarks. I'm honored that there's time and space being created for what is a really important and timely and urgent dialogue. So I'm a primary care pediatrician at Boston Medical Center, which is the largest safety net hospital in New England. And I'm a researcher who focuses on social and structural factors that impact population health. And a lot of my work is through Vital Village Networks, where we collaborate with residents and organizations to build strategies to promote well-being. I'm also a parent, so I come to this with a lot of personal, professional commitment of my entire career. So as a primary care pediatrician at a hospital that predominantly serves what could be defined as low-income patients and families, I know firsthand that all parents, regardless of their personal resources, seek to ensure that their children have what they need to thrive. And I think we can all agree to that. And necessities like nutritious food, safe and stable housing, high quality education and childcare and healthcare are the basic foundations of children being able to thrive. And when we talk about policies that affect income supports for families, that's exactly what we're talking about. And we know when children don't have access to these basic necessities, even for brief periods of time, their health is jeopardized. And the research in this incredible issue of health affairs, as well as lots of building and well-established evidence, shows that when children and families are struggling with food insecurity or housing insecurity, they're more likely to be in poor health and have risk for developmental delays and experience learning difficulties at schools. And adults who are food insecure and housing insecure have increased rates of mental health issues. And we know that this has only worsened in the context of the COVID-19 pandemic. And it has really exacerbated a lot of the roots of the challenge that we're facing. So I'm really hoping in our conversation today, we can really think about some of the roots of the policies that we are working to reform and improve, and why those roots, whether they be in structural racism, sexism, patriarchy, need to really be understood in order for us to move forward and have truly equitable policies that ensure social supports, healthcare access and beyond healthcare access, as well as healthy community structures. I'm hoping our dialogue can also telescope out from individual families, which a lot of the policy discussion focuses on, to really thinking about healthy communities and populations, and what our social contract is for children in this country. How do we support the best outcomes for all children? So I'm very excited for our conversation today.
Thank you so much for leading us off. Jessica, I'll turn next to you.
Yeah, thank you so much for the introduction and for having me join this panel. I'm really excited about the conversation and have been and was really impressed just kind of taking a look over the research that is in this issue of health affairs, and I think also really impressed by the diversity of voices that you all were able to put together. I am the Vice President of Policy at the Joint Center for Political and Economic Studies, and we are a research organization, and we focus specifically on issues affecting Black communities in the United States. So our goal is to identify those policies that will help to tear down some of the structural barriers to the full freedom of Black people in this country. Personally, I think, because Jennifer shared, I will share a bit as well. I think I come from a family where folks, including my parents when I was younger, relied on income support programs to kind of help our family to thrive. And both of my parents are in the service sector. My dad's a social worker. My mom was a teacher before she retired. And I think, folks with families in these professions probably are used to the stories of what happens when programs like this are expanded in a place, and what a difference it makes for their day-to-day lives, the lives of the children that they interact with all the time. The Joint Center comes to this conversation in particular because we're interested in making policy more inclusive. So that's about both increasing representation in policy debates, that's increasing the diverse scholars, diverse congressional staff, diverse leaders in our governments, and increasing equity in our policies. So this conversation in particular, we're coming to because we're deeply focused on issues related to making the tax code more equitable. Some of you may be familiar with the work of Professor Dorothy Brown. Her recent book, The Whiteness of Wealth, highlights the inequities in the tax code and shows how policies that we may think of as race neutral actually cause inequities, cause disparate outcomes for communities of color. So I'm really hopeful that as this conversation proceeds, we can talk a little bit about the tax policies that are highlighted in the issue, and how we can ensure that they reach more folks, right? Reach the communities that need the support the most.
Great, thank you. Jennifer, do you want to add a few more thoughts, or do you feel like you covered in the introduction? It's up to you.
Let's jump into the conversation, but just
Okay.
resonating deeply with the look at the social contract and needing to go deeper. Thank you to you both.
Well, let's dive in. So, Jessica, I'm really glad you mentioned the reality that things that someone without the historical perspective may look at it and say, this is neutral. I don't see race in here. I don't see black, white. But that doesn't mean there aren't significant disparate effects. And as a student myself of the safety net, I'm fully aware that many of those disparate effects are quite intentional. Some are happenstance, but many of them are by design. I don't want us to spend our whole time doing a history lesson on the social safety net because we want to look forward, but I also don't think we can solve problems if we don't understand the roots of the problems. So I wonder if we could spend a little bit of our time talking about some of the particularly racialized aspects of how the safety net has been designed to have intentionally disparate effects. And maybe some places where we've been able to overcome some of that to give a sense of potential for improvement. So why don't, if any of you want to sort of jump in with a little bit, I can barely, Jessica, see a cast in the background on your bookshelf. So I know I'm not the only one here looking at these kinds of issues. Who'd like to talk a little bit about the historical context for these programs?
I can start, and I can start on from the tax policy angle, for example, in terms of a race neutral policy that has disparate outcomes for communities of color. So the child tax credit example that has had a very big past 2 years. The child tax credit is a policy that provides credit to families who file their taxes who have children. It's based on the number of children that you have, but the way that the program was designed, it's not, I'm not going to get super wonky. It's not fully refundable, which means that families that do not file their taxes don't actually receive the credit, right? The government is not mailing them a check. Also, families that earn too little to experience the full value of the check don't receive, or the child tax credit don't receive the full benefits. So that ends up accounting for 45% of Black children, 39% of Latino children, 38% of Asian American children, and 17% of white children. What you, I'm sorry, I got that mixed up. 38% of American Indian and Native American children, and 16% of Asian American children. So what you have is a credit that's supposed to be just based on if you have kids and if you need some help. And it ends up having these like really disparate outcomes that end up affecting communities of color in significant ways. I think that, you know, you could almost do this with any policy area that you want to think about, which is really unfortunate. But, you know, that would be one of the things that I would highlight. And yeah.
I'm so appreciative of your thoughts, Jessica, and I'd love to connect there too, taking a look at some of the TANF policies and the historical roots. It would really be impossible for us to understand TANF policies and our cash supports to families without understanding the history of slavery and Jim Crow in this country. And some of the narratives that were enforced through that process of who needs to be told to work, who's lazy, who's promiscuous, whose reproduction and labor needs to be managed and controlled, what work is worthy and who is deserving. Right? So that narrative of deservingness we see in the enforcement of what a federal policy is that is state and locally implemented, you know, at the bequest of a lot of local and state program administrators. Is it a widowed mother who receives cash assistance, or is it an unwed mother who receives cash assistance? Does the decision of who's deserving of that cash assistance, is that influenced by race, ethnicity, and income? We see that there is a lot of penalization of families because of poverty. So we see a strong tie between the child welfare system and our cash assistance program as well, in terms of surveillance, sanctions, and policing of poor families and disproportionately families of color. We see that as policies were rolled out historically, they often were able to exclude in their local and state-based implementation exclude families of color disproportionately. So questions of what kind of home is suitable, the idea propagated through the Moynihan report around the values and the culture within communities of color, the idea that a culture of poverty is propagated, and then of course ideas around personal responsibility and who is a fit parent and who is an unfit parent. So when we look at the barriers to growing and expanding these programs and the reasons, some of the complexities for families with navigating these programs, we really have to understand that history and how it has played a role in how they've been shaped and how they are implemented and enforced. And many of the studies in this journal articles issue shows the inequitable access to the same policy, so particularly among Black and Brown communities. And of course, we have integrations there around other forms of bias, xenophobia, anti-immigration sentiment, the idea of English language proficiency and language access and justice. So I think all of these are tied into intersectional identities that have been disproportionately disenfranchised and marginalized by policies.
I'll just add one final thought, which is we need to think about how we value care when it comes to families. And that is deeply rooted in these historically racist structures as well. I want to just be a personal hype woman for both Renee and Jessica, but what I would actually say is when we think about caregiving in this country and look back to that legacy of slavery, what we know is that care was only valued under certain conditions, and those conditions were largely based on sort of extraction and labor, and those very harsh and punitive ways about thinking about work were not grounded in people's dignity. They were grounded in the prosperity and wealth of some versus others. And so when we actually think about these policies, how do we begin to acknowledge and uplift the deep and vital role that caregiving is in this country, and understand that in unto itself, it is a reason to be supporting people and to ensuring that they deserve the types of supports, the types of well-being that will help them thrive.
Well, I can't help but add my own footnote, Jennifer, since you opened up that line of discussion. I think we need to acknowledge that many of the programs were designed very intentionally to exclude the provision of any assistance to particularly Black women, although not just women and not just Black women, to keep them as an available low-wage workforce for domestic labor or for field labor for the men, whether that's the exclusion from unemployment compensation from certain kinds of work, whether it's allowing states to set extremely low thresholds for income cutoffs for the old aid to families with dependent children and now TANF program. All of these were intentionally designed to keep the workforce at a low wage rate, and particularly the workforce that was caring for others in the home or providing the economic engines for this country. So it is the history, and if we don't face it, we can't do anything about it. And I know there are those who would rather not, but the four of us are not among that group, and I hope our audience isn't either. So let's try to pivot to, I'm sure we'll continue to call upon what's been discussed. Acknowledging that history, the programs discussed in the papers that we'll hear presented momentarily and others that are not covered as directly in these papers do provide important sources of economic support to many families. And we don't want to lose the positive of that while we acknowledge the limitations. So I wonder if we could at least begin talking about the positive potential of some of these programs. Jessica, you sort of started that off with the child tax credit. It could do this, it's just not doing all of it. And I just wonder if we could have a little bit more of a sense of what the potential is here, if we could overcome some of these historical attributes and some of the present day discriminatory practices built into them. If our goal is better health, how can these programs contribute to that?
Be happy to share a couple of examples. I think we saw that the expansion of SNAP, the pandemic electronic benefit transfer, those had a significant impact. We saw extreme benefits related to the expansion, the quick expansion of those relief programs. And we saw improvements in terms of access to nutritional needs, engagement in educational, processes, and, family stability. It was short term, unfortunately. So I think that's a critical question for us. We now have very recent memory evidence with that expansions are leading to positive benefits. We also have evidence from a number of studies showing that giving families cash that they can make decisions with are also extremely beneficial, particularly for families with very young children. And so this is all evidence pointing to the fact that, one, we do not have a sufficiently resilient local food economy and food access and security for families, nor housing access and security for families that's high quality. And I could add to that childcare as well. And we have to begin to start viewing these as interconnected instead of exchangeable policies as well. So there are more efforts to bundle these policies to promote comprehensive, holistic health and well-being for families. So I think that's another critical area for us to look at, of how do we improve policies by seeing them as interconnected. And obviously some of the papers talking about things like cliff effects are really pointing to what happens when you pit one piece of effort against another. If you work more and you lose benefits, or you lose childcare, or you lose a really needed and beneficial support, that is really undermining the dignity, agency, and decision-making that families can really do a good job of when they have adequate supports. So this is really speaking to a different type of social contract and perhaps connections between these programs and policy.
Yeah, I think to add on, and one thing that I was thinking about as we were discussing the like racist history of a lot of these policies share, is that like we all end up being hurt. Like none of us get to see the benefits because people have wanted to exclude Black people from these policies, but so badly, right, that our friends and neighbors also aren't able to take advantage of them, which is, I think, really unfortunate. And thinking about how connected we all are is really important to thinking about what we could achieve in the future. I think we've been thinking a lot about how to reform the tax policy specifically to make them more inclusive, and that's about take up, which I know is included in the issue, and all about participation rates for eligible families. But it's also about like not penalizing people who claim certain benefits, right? So in the case of the earned income tax credit, we know that the IRS has in previous years targeted EITC earned income tax credit claimants. So the people who can least afford to sort of challenge the IRS when they're audited are the ones that where actually the audits are concentrated. And so thinking about how once we have something that we think is an effective policy, making sure that people aren't penalized for trying to use it. And I think there's also a piece of expanding the good policies. We know, I think we've talked about how important cash-based assistance is. I think of the CTC as kind of like as a cash-based assistance program. And what we saw when it was expanded last year and made transformed into giving monthly cash-based payments directly to families, people spent that money on things that they needed and things that would help their families to thrive. People bought food, they paid for their housing. I have personal anecdote. I feel like it's the kind of thing that's illustrative of what this kind of policy can do. I have a cousin that was like trying to find a place to live and was staying with my parents, her and her daughter. When these payments started, she was able to more quickly save her security deposit so that she could find a place for her and her daughter to live, right? Like that's the kind of difference that these policies make and these policy reforms make for people in their day-to-day lives. That is transformative, right? For a parent and for her child in terms of what their day-to-day is going to look like. So I think those are the kinds of things we should be thinking about in terms of the difference that these things can make.
I'll only add, it's simple, do what works. And I think what I will say is a concern is it feels like sometimes this is the last priority. I mean, we had so many conversations during the pandemic, the core of the pandemic, I should say, it isn't over, of which were focused on how we build resilience in our society. And yet we were implementing programs at that time, the expanded child tax credit, stimulus payments that were literally changing the lives of families. And we chose not to make those permanent. And what is even more true is that we actually said, let's get the barriers out of the way. So we simplified and streamlined processes. We tackled some of these pernicious issues that were keeping families out of these programs. We did things, for instance, like expanding school lunch eligibility. And instead of making families go through draconian application processes. And yet now we've turned back the dial. And if it worked, why aren't we doing it? And so that's what I would say about a lot of this stuff, which is we actually do have a lot of research and information, including what is being bolstered through this issue about how we can do these things simply and really make these transformative efforts or transformative programs in the lives of families and allowing them to step into their power and do what they do best, which is take care of their children and their other family members.
You know, I'm struck as I listened, one of our audience members asked a question about retaining the school lunch, universal school lunch. And I'm struck by, on the one hand, we did a lot of expanding of benefits, and one simple, logistically simple thing would be to sustain those expansions. But that's hard to do whenever the sense of crisis has passed. People may feel that it's time to go back to the old ways. But I'm thinking about the example of telemedicine, which I realize is not our agenda today. But with the COVID pandemic, we removed a ton of administrative barriers to telehealth that had been in place for decades. People said they were absolutely essential. And we stripped them away in essentially no time. And now there's a whole move afoot to preserve the higher levels of flexibility to enable that to continue. So I guess my question is, setting aside, not that it should be fully set aside, the question of level of benefits, is it possible to initiate a telehealth kind of campaign that says, we get that maybe we can't expand these programs forever, but at least some of the things that improve their accessibility, some of the rules that we had designed to keep people out, is there any way we could get rid of them? And by gesticulating, I set off the motion sensor in my office and the light went on and now I'm in the dark. And so I'll have to sit quietly for the light to go out. Someone else.
I think telemedicine is a wonderful example. And the question is, why didn't telemedicine roll back, right? And I think you'd have to say that there was some degree of valuing patient's perspective on that experience that really resisted it being completely pulled back in the same way, right? So healthcare industry is somewhat consumer driven in some respects. And I think that's one example of it. Whereas when we're thinking about assistance to lower income families, they are not being viewed as equal partners in designing this system. And I think this is an example, a significant example of that absence of really honoring and embracing their agency and the agency of local communities. Food was expanded and delivery was expanded, but communities often weren't engaged in the type of food, the quality of food, where that food was sourced from. So there could have been a broader engagement that really would build the resilience and perhaps lead to healthier, more sustainable and more culturally relevant outcomes that would benefit health as well and boost the economy and boost, kind of the fitness of the entire community. And so I think, again, we have to go back to who is viewed as the decision makers in designing this system, and why isn't it not more family centered? Why aren't some of their concerns and decisions being accounted for more? And I think some of the qualitative papers are truly bringing out information that commonly is not heard or considered when programs are being designed. There are a lot of assumptions made about why people use programs or don't use programs or do certain things or don't do certain things. So I think that that's a fabulous example of, if we could structure accountability slightly differently and partner with the society more in the design of these programs, things could change.
I will certainly just add, in the way that Renee talked about us having interdependent programs, we are interdependent. And we have yet to recognize as a society that families are the cornerstone of that society. We do treat them individually, one by one, case by case. A lot of the practice in this work is called case management, when actually at a higher level, this is about both who we are as a country, what our values are, and how we actually make progress and achieve prosperity together. And so I'm often asked what keeps me up at night. And one of the things I know is that because these programs have expired, there are children who are now not getting healthy, nutritious meals at home. There are people trying to make impossible trade-offs. And all of that is true. And that keeps me up at night. But is it keeping the folks who are controlling resources and making decisions about those resources up at night? And so it calls on us to really ask the question who we are as a country and what is it that we are prioritizing. And I certainly think from my vantage point, we have to actually change the conversation in a way that families are a priority, because we recognize that that is actually about us, not about folks over there.
Yeah, and I think in addition to both of those really great points, the expansion of certain programs really showed everyone what was possible. Like gave people an opportunity to kind of dream a little bit bigger in their asks, certainly. And I think, and I hope that folks continue to demand the kinds of policies that help all of us thrive. I think the Biden-Harris administration on day one put out this racial equity executive order, and it feels like it was a long time ago. It was about 2 years ago now, almost 2 years ago now, that mandated that federal agencies think about where the barriers are to participation for the many programs that the federal government provides. My understanding from friends that have worked in these agencies is that they're trying really hard to figure out where the barriers are and make the kinds of changes that that need to be made to benefit us all. But there's also, racism isn't new. Disparities didn't happen in 2 years. They're not going to be fixed in 2 years, right? We're kind of fighting hundreds of years of structural barriers to people being able to fully participate in the economy, to fully participate, kind of make the decisions that they need to make for their lives and for their health. And so I think it is a frustratingly slowly moving train, but I do remain hopeful that the work that many of the advocates that I have the opportunity to speak with all the time, that work is moving us in the right direction.
I was struck both positively and somewhat depressed, Renee, by your comment about the validating the patient perspective and that being part of the ability to sustain, although it's not permanent, but to thus far sustain the willingness to let some rules go around telehealth. I can't also help but think that another powerful constituency is healthcare providers, and social workers and poor families are neither doctors nor middle-class patients whose voices are easier to get into these discussions. And so that, and then the biases and assumptions, Jennifer, that you mentioned earlier, and Renee, you as well, play out in terms of concerns about and the oversight. And I won't drag us down there, but we are in a place where who is sending the message matters, and who will be heard and listened to and respected really matters. Which leads me to a question, I'll say Dr. Boynton Jarrett, because I'm going to ask you to put your doctor hat on, although I'm sure you always have it on, which is about, as a pediatrician, about the role and the political and practical dynamics. Jennifer, you mentioned, individual and case, and at least rhetorically, we say we care about children in this country, but children grow up in context, and a primary context of that is families, and how we feel about the parents and their behavior in the family doesn't always align with how we feel about the children, and it is really revealed in our policies. And so I wonder if we could have a little bit of a discussion about the relative both health merits and demerits of focusing on children, as well as the political merits and demerits of focusing on children as a target group for programs, but also how it can have implications isolating them from the care networks and families that they grow up in. Any thoughts on that topic?
It's such an important question. I think it hits at a lot of the challenges. So children don't have a vote, right, in this society per se. And I think the absence of a comprehensive investment in their well-being and care, the fact that not every child has health care access consistently, not every child has food consistently or quality childcare education really speaks to that. And so, I think we really have to broaden and bring in a human rights framework to really think about how does our society support the needs of children, but the absence of them to actually be able to, rally for their rights may be part of the reason why they are underinvested in as well in our democracy. I think also we have learned a tremendous amount about the inability for children to thrive in the absence of their families and communities thriving. So children do not exist in isolation. They grow, thrive, and develop in a network of relationships. So if we have policies that feed children, but cause family caregivers to make choices between feeding themselves or feeding their children, getting healthcare and medicine for themselves or doing so for their children, caring for their children, perhaps to the detriment or expense of their own mental health and well-being, because there are insufficient supports for their needs, or the lack of basic policies like paid family leave to support that attachment, bonding, and relationship building, the absence of the ability to take sick leave when your children are sick. And so all of those factors, kind of pretend that you could kind of take care of the health of children without considering the relationships that they have to their caregivers. And so what we know is that probably the most critical medicine, therapy, or importance in the life of a child are the primary caregivers. Sometimes those are parents, but sometimes they're grandparents or extended family members who often cannot access the benefits needed, right? And so we have a child welfare system that's really being called into question, because often there is a disproportionate focus on surveillance and investigation, and an insufficient focus on support and care and compassion. And a lot of the surveillance and investigation, things that happen when you are in poverty come up as flags there. And so I think, really need to have a more compassionate and broader lens and a human rights centered approach that, one, acknowledges like the investment in the well-being of children cannot take place without an investment in caregivers and thriving communities that support those caregivers as well. But we also have to think about other providers that care for kids. So if we don't care about the health benefits or mental health of child care providers or school teachers, that's problematic, because children are spending a large portion of their time with those caregivers who also need health care and healthcare access. So to me, healthcare access is an important bar, but it's a very low bar when we're thinking about what it really would take to accomplish health equity. And I think a hidden piece here, I'm sorry if I'm rambling on, I think a hidden piece here is often when we are talking about the relationship between income and health, we are thinking about income, but we're not thinking about wealth. We're not thinking about education and access to education, and all of these other associated factors with socioeconomics. And so we also have to think about the value of having and building wealth for families, or restoring wealth that has been systematically withheld and or stolen from families in our Indigenous communities and our Black and Brown communities, and the impact that has on child trajectories.
Not rambling at all. Thank you, though, for all of that. Well, as we come to a close on this panel and move toward our research presentations, I do just want to give each of you an opportunity. I hate getting asked these questions, so please forgive me for asking them. But I really would love to hear, and I think our audience would benefit from sort of the one thing you would hope we could do or take away to improve the equitable access to the financial supports that families have. And I have on good experience with Jennifer that she has too. But I'm going to ask you to try to keep to one or two at the most of what you think would be, given the goal of equitable access to health and the critical role that income supports play, what would you suggest our audience focus on to increase the odds of achieving that outcome. Whoever'd like to go first.
I will do this since I know that we've discussed this a little, and I'll just say this. On the whole, we need to revisit our social contract and build a new one that is incorporating of families. But when I think about how we get specific, I'm going to go to both things that Jessica, Dr. Boynton Jarrett have said and say we need to recognize families as they exist in this country. The tax code is the first place you can go to find out how families are narrowly defined, inaccurately defined, and excluded, and how that cascades to all the other programs that we've been talking about today. And that is deeply embedded in our history of who we recognize in this country as families. So that is, quite frankly, a simple way in which we could make things better through a small shift.
Excellent. Jessica.
Unsurprisingly, I 100% agree with Jennifer. I think in addition, if we could design policies in a way that allow and potentially help families to build wealth, because as Dr. Boynton Jarrett said, that is a really important indicator of well-being. And the way that I think about it is wealth allows you to make the choices that you need to make to keep yourself and your family safe, and to make the decisions that you need to make to help your family thrive in the future. So yes, plus money for everyone, right?
I don't know how to answer this question, but I would just say we have to be ambitious and bold and sweeping. We can't be comfortable with any child being hungry, cold, unsafe, unsheltered. Comfort with that at any level. That would, to me, mean centering those who are most likely to be marginalized in our society. If they were centered in every policy we thought about, I think everyone would be cared for. And so it's just recentering who should be at the center of each policy being developed, and it should be the members of our human community that are most marginalized and have been least heard.
Well, I loved those answers, all of them, in each of the directions you took us. So I'm very appreciative. And I'm glad I asked the question even though I don't like answering it myself. To all three of you, thank you so much for insights, thoughts, personal reflections, sharing a bit of yourself. It's just been a wonderful conversation, and I'm appreciative of the time you've given us and to our audience. And we'll now move into a presentation of the research, which goes into many of the themes that we've just discussed here. And so I'm going to take this opportunity to quickly introduce our authors who will be presenting. You're going to hear from Kes Ballantyne, Assistant Professor in the School of Social Work at Wayne State University, Rita Hamad, Associate Professor of Health Policy Studies in the Department of Family and Community Medicine at UC San Francisco, Sunia Faruqi, Senior Data Analyst at the Heartland Alliance, Dana Thompson, Senior Research Scientist at Child Trends, and Donna Ginter, the Roy A. Roberts and Regents Distinguished Professor of Economics and Director of the Institute for Policy and Social Research at the University of Kansas. And the way we're going to do this is we're just going to move from one presentation to the next. They'll each have a handful of minutes to present their findings, and I will continue to gather questions from the audience, including one or two that maybe didn't get into the discussion so far. But do feel free to continue to submit questions through the Q&A button, and we will have a little bit of time for that after the presentations. With that, Kes, you're first up, and looks like you're ready to go, so I'll turn it over to you.
Thank you so much for the opportunity to speak with you today. Policymakers across the aisle are concerned that increasing wages for low-paid workers could cause negative unintentional effects, including initiating public benefits cliffs, where increased income results in public benefits losses that are larger than the income increase, leaving families worse off. Economic models have provided evidence for this concern, and in some cases recommended against wage increases. Our research suggests that relying only on economic modeling is insufficient for understanding how parents make difficult choices to make ends meet, overemphasizing financial resources over other relevant factors, including time, community and family supports, stress, and health. Today, I am pleased to present on research funded by the Robert Wood Johnson Foundation and done in collaboration with University of Pittsburgh School of Social Work professors Sarah Goodkind and Jeffrey Shook, who join in the audience. Our research uses a qualitative approach to carefully examine the interactions between public benefits access and parents' employment decisions to inform bipartisan policy efforts to better support working families. Now, as you know, many Americans earn significantly less than they need to make ends meet. For example, 1/3 of American workers earn less than $15 per hour, and both low and middle income working families have been shown to face material hardships and chronic stressors associated with poverty, which of course have serious negative effects on family health and well-being. Though intended to alleviate hardship and stress, using public benefits like food stamps, Medicaid, and housing vouchers can in and of itself be stressful. One of these stressors are benefits cliffs, where losses in public benefits may exceed wage increases. These can be experienced as steep cliffs, a series of mini cliffs, or a long period of no net gain called disincentive deserts. Though contributing to financial precarity, it is unclear whether benefits cliffs, large or small, create disincentives to work. To understand how raising wages affects parents' public benefits use and their ability to provide for their children, we conducted 2 interviews each with 25 parents from Pittsburgh, Pennsylvania, between June and December 2020. To participate, parents had to have at least one child younger than 12, earn less than $18 an hour, have earned at least one wage increase in the 3 years preceding the interview, and have used at least one public benefit during their parenthood. Participating parents were primarily Black unmarried mothers with an average hourly wage of $12.99 and an average of 2 children. We asked parents to narrate their child rearing, life, work, public benefits, and education histories since the birth of their first child, and worked with them to draw a life timeline. We asked them about their experience using all available public benefits, including federal, state, and local programs. We looked for patterns in how parents described their lives, particularly around changes in jobs or public benefits, to understand their decision-making. We found that parents who increased their income did experience reductions or losses in public benefits. However, parents rarely chose to reduce their working hours as a result. It was more common for them to work more hours and seek better jobs. Overall, parents sought to secure the right balance of resources, including money, time, energy, and in-kind resources. To briefly highlight the key findings, I'm going to share the experience of one of our participants, a mother of 2, whom I will call Gina. Gina was a typical case in our study, in that she made different decisions about work and public benefits across time, as she attempted to secure the right balance of resources. Prior to finding she was pregnant with her second child, she got what she thought would be a great job at a VA hospital, increasing her wage from $11 per hour to $14.90 an hour. This large wage increase caused her to lose both food stamps and Medicaid. A few months later, she quit that job. Money was a factor. As she said, I was making more money, but it still wasn't enough to fully provide for me and my family, me and my children's medical, and to pay for food. However, this was not the only reason for quitting this job. Other factors she attributed to her decision included having a difficult schedule, a supervisor who belittled her, and a workplace policy that negatively affected her childcare. A few years after leaving the VA, where she had earned $14.90 as a health aide, she got a job as a hospital receptionist for $15.99 an hour, prompting another public benefits cliff. However, she continued to work there because she felt that this job added more than it took from her balance of resources, including a consistent family-friendly schedule and a better working environment. Gina's experiences highlight how parents' decisions are dynamic over time, depending on the specific needs of their children, the available jobs and their quality, and the overall availability of supports. Overall, we found a range of contributing factors beyond income that influence parents' decision-making around the balance of employment and public benefits, including job quality, community and family supports, parents' energy level, and the amount of work it took to apply for and maintain public benefits. The work to balance these many factors were tremendously stressful for parents, drained extended family resources, and often resulted in inconsistent access to essentials like healthcare. Our findings underscore the need for better supports for working people with low to middle incomes and provides important lessons for members of today's audience. Parents struggled to find good quality and family-friendly jobs that facilitated financial security. Thus, our findings suggest that policymakers focus less on creating incentives for work by tying public benefits to employment, and instead focus on alleviating labor precarity and financial insecurity. In addition, the public benefit system needs to be aligned, simplified, and expanded to provide ongoing and universal supports for parents navigating the labor market. Thank you. We look forward to questions and further discussion.
Thank you. We're going to move to Rita.
Hi. You guys hear me?
Yes, sorry about that rough start. There you go.
Okay, great. All right, there are the slides. Great. So thanks so much for the introduction. I'm delighted to be presenting today on the results of our study examining take-up of the EITC among low-income Californians. Next slide, please. As many of you know, the EITC is the nation's largest poverty alleviation program for families with children, but take-up of the EITC is only about 78% nationally, and California has among the lowest take-up rates at about 73%. Half of states also have a supplemental state EITC benefit. California's is known as the Cal EITC, and it was introduced relatively recently in 2015. Take-up was only 50% in 2017, although it might be higher now with increasing awareness of the program. And together, the EITC and Cal EITC can provide over $7,000 annually for eligible families. Next slide. There's limited research on the reasons for low EITC take-up. Prior work has primarily relied on administrative data like tax records to suggest several possible explanations. One is, of course, lack of awareness of the EITC. Another is confusion around eligibility requirements, especially for non-traditional families like divorced households. And there's also a high administrative burden that makes tax filing itself difficult, and the IRS instruction manual for the EITC is notoriously long. Finally, those with low incomes below a certain threshold aren't required to file taxes at all because they're unlikely to owe taxes, but this also means they miss out on the EITC benefit. So next slide, please. This brings us to our project, the Assessing California Communities' Experiences with Safety Net Supports, or the Access Study. So our goal was to describe characteristics of those who don't receive the EITC, and then to conduct one of the first studies to elicit firsthand responses from EITC eligible families to understand self-reported barriers to take up. Next click, please. Respondents were recruited in partnership with community-based organizations, other safety net programs, and through referral from other study respondents. We ended up with 411 people who met federal criteria for EITC eligibility. I think you can click through once or maybe even twice. That's good. Interviews were conducted in English or Spanish and included questions on demographic predictors and take-up barriers. And rather than relying on self-report, we verified EITC receipt using actual tax returns among those who had filed taxes. Next slide. In terms of demographics, about 94% of the sample were women, more than 3/4 were Latinx or Black, 83% reported English as their primary language, and about 3/4 spent most of the last year working full-time or part-time. The remainder were primarily unemployed, but had nevertheless earned enough money to qualify for the EITC, and median income was about $18,000. Next slide. So we found that 9.5% missed out on the EITC simply by not filing taxes. And another 11%, the gray triangle, filed taxes but weren't able to share their returns with us, so we couldn't confirm their EITC receipt. Of the remaining 79% who shared their returns, I break it out further in the second chart. Click through, please. And here you can see 15.6% of tax filers didn't receive the EITC despite being eligible based on the information they provided to us. Next slide. This shows the tax filing method used by each group. In yellow is the overall sample who filed taxes, and the blue and green are the subsamples of filers who didn't and did receive the EITC respectively. You can see the majority used TurboTax or a CPA. Only 6% used VITA, which is a free in-person filing service. And when comparing across groups, we need to be cautious because of the small sample size, but we saw that those filing with TurboTax and other online programs were a little less likely to receive the EITC, while those using H&R Block and VITA were more likely. And one more click, please. We were also surprised that 2/3 of our sample paid to file taxes, even though the sample should have all been eligible for free filing. Next slide. EITC awareness was similar across both non-filers in red and filers in yellow, but among those who had filed, only 41% of those who didn't receive the EITC reported awareness, shown in blue, compared with 68% of those who received it in green. Remarkably, this also means that over 30% of those who actually received the EITC based on our review of their tax returns didn't realize they were recipients. Next slide, sorry, next click. In terms of where study participants had heard of the EITC, most had heard of it from IRS documentation or a tax preparer. And those who didn't file taxes were, of course, less likely to hear about it in IRS documentation and were disproportionately more likely to have heard of it from friends, family, or their employer. Those who had filed and not received the EITC were less likely to have heard of it from a tax preparer and more likely to have heard about it in the media. Next slide. Finally, here are the adjusted models showing which variables were associated with tax filing on the left, and then EITC receipt among tax filers on the right. So for tax filing, greater family income and working were associated with tax filing, while TANF recipients were less likely to file taxes. On the right, among the sample who filed taxes, EITC receipt was associated with older age, speaking English, and having heard of the EITC. Results for the Cal EITC are shown in the manuscript. They were similar, but in some cases not statistically significant, perhaps because the sample eligible for the Cal EITC was smaller. Next slide. So this brings me to our recommendations for future policy and program investments. First, our findings suggest that free tax filing services need to be more readily accessible. There's also a need for more filing support for non-English speakers. Tax forms are available in Spanish, but clearly that was not enough for participants in our sample, and challenges are probably greater for speakers of other languages. Additional outreach and interventions are also needed for the lowest income individuals who were less likely to file taxes, even though Cal EITC benefits are actually largest for these families. Similarly, there's missed opportunities for reaching populations likely to be eligible for multiple safety net benefits. Creating a unified, simple application to determine eligibility for all programs would streamline the process and could increase awareness and take-up. And finally, we found that awareness is important to boost claiming of the EITC, and moreover, ensuring that beneficiaries are aware that they received the EITC could be important in facilitating public debate about the role of government in providing a social safety net. One more slide, please, just the acknowledgements for the funding and my co-authors and the study staff. And last slide is just the thank you to all of you all for listening. Thanks.
Thank you, Rita. We'll move now to Sania.
Hi, everyone. My name is Sania Faruqi. I'm one of the co-authors of the Temporary Assistance for Needy Families, Sanctioning and Child Support Compliance Among Black Families in Illinois. Next slide. We conducted a community-engaged mixed methods research project seeking to identify barriers to accessing and maintaining temporary assistance for needy families, aka TANF, among families with young children in Illinois. When I say community engaged, what I mean is that we partnered with Chicago Coalition for Homelessness to recruit 5 research advisory board members with deep community-driven advocacy experience who received TANF, and they were co-collaborators on this research project. Next slide. We had 2 main data sources. We had TANF administrative data from Illinois Department of Human Services from 2017, 2020. We ended up using 2018 to 2019 because of completeness of the data. And then we also had 19 interviews. Our interviews were with individuals older than 18 with at least 1 child under the age of 5 in either 2018 or 2019. Next slide. For our methods, for the administrative data, we used logistical regression and Fisher's test. For the qualitative data, we used thematic data analysis and mind mapping. We worked with the Research Advisory Board to collaboratively develop a code book. Next slide. And then we grouped our categories into primary and secondary barriers to accessing a TANF, as you can see in the visual. Next slide. For the quantitative findings, we found that 24% of enrolled population were sanctioned at least once in 2018, and 73% of Black families received at least 1 sanction compared to 20% of white families. And then when we look at families that had lost TANF, 73% of Black families had at least 1 sanction compared to 21% of white families for the same year. Next slide. We see a similar trend in 2019, where 20% of the enrolled population was sanctioned at least once. 73% of the Black families received at least 1 sanction compared to 20% of white families. 72% of Black families who lost TANF received at least 1 sanction, and this was compared to 20% of white families in 2019. Next slide. Black families were 111% more likely than white families to receive at least 1 sanction in 2018-2019. Next slide. Among families that lost TANF, the vast majority of TANF families were sanctioned for reasons related to bureaucracy and child support compliance. And then when we look at who is being sanctioned, we found that Black families received more sanctions for child support non-compliance compared to white families. Next slide. The qualitative data really provided important context as to why TANF customers might not comply with the child support enforcement. Among mothers with young children who were survivors of intimate partner violence, they often had difficulty getting good cause waivers because they were unable or could not provide the paperwork or evidence needed to get those waivers. Next slide. We also found that a number of interviewees were in parenting relationships with their child's father and knowingly avoided interacting with child support system because they knew that it would negatively affect their father. Next slide. Some women did not want to pursue child support because it either prevented them from receiving critical cash assistance or reduced the total amount they and their children received. Next slide. For impacts, reducing as research has shown that reducing cash assistance pushes families and children further into poverty, with one of the consequences being that this has a lasting impact on children's health and development. Next slide. I'm going to go into policy recommendations, but to recap, Black families enrolled in TANF were more likely than families of other races to be sanctioned, and specifically to be sanctioned for child support non-compliance reasons. Child support non-compliance is a major barrier for many families not receiving TANF. So for our policy recommendations, we recommend that the state move away from restrictive, punitive cash-assisted systems and toward a system intended to help families thrive, aiming for for a family-centered cash assistance system that is not based on values and value-based outcomes. And so this could remove child support compliance or work requirements. Also, we recommend that the state bar states from using sanctions that either reduce benefit amounts or eliminate cash assistance altogether. Currently, there's a bill in the Illinois Assembly, HB 4423, and this would increase TANF grant amount, and it would also direct IDHS to send funds collected from non-custodial parent to a custodial parent and their children. Next slide. Cash assistance can be a major lifeline for many families living in extreme poverty, and it should not be made so difficult to receive or maintain. That's like just want to thank everyone. Also, this report is actually part of a larger report that we've done called Resign to the Process, Barriers to Accessing and Maintaining TANF Among Low-Income Families with Young Children in Illinois. Thank you.
Thank you so much for that presentation. We'll move now to Dana.
Thank you so much. It is a pleasure to have the opportunity to present my work with co-authors EU Chen, Lisa Janetian, and Luis Basurto on uptake of the Earned Income Tax Credit among Hispanic families with children nationally. Next slide, please. So Rita has already familiarized us with the EITC, and I won't repeat that information, but I do want to reiterate that the EITC has specifically been linked with improved maternal and child health outcomes. It has also been found to reduce inequities in these outcomes, in part because poverty is a key risk factor for poor health outcomes, and poverty disproportionately affects children of color. But some studies have also found that the effects themselves of increases in income due to the EITC are actually larger among racial and ethnic minorities and among single parent households. Next slide, please. Using nationally representative data from the 2014 panel of the Survey of Income and Program Participation, we found that income eligible Hispanic families were less likely than all income eligible families to report EITC receipt. By contrast, they were more likely to report that they filed an income tax return but did not receive the EITC, and more likely to not file a return at all. And this was true even after adjusting for a wide range of family and state level characteristics. Next slide, please. In looking at heterogeneity in EITC receipt among Hispanic families, we found 3 factors associated with lower odds of receipt and 1 factor that was associated with higher odds of receipt. So in the figure on the screen, odds ratios below 1, so to the left of the red line, indicate lower odds of receipt compared to peers, while odds ratios above 1 to the right of the red line indicate higher odds of receipt. Factors whose error bars overlap with the red line do not have significantly different odds of receipt compared to peers. So looking on the left-hand side of the graph, we see that among Hispanic families, having a parent who was self-employed, having a non-US citizen parent, and having a parent with lower English proficiency were each associated with lower odds of EITC receipt. So 42%, 34%, and 28% lower odds respectively compared to their peers. On the right-hand side of the graph, we see that Hispanic families that participated in other safety net programs had higher odds of receipt, about 56% higher. Next slide, please. In additional analysis, we took a closer look at citizenship factors and found that among Hispanic families, those with a non-citizen parent who arrived in the US as a permanent resident or a non-citizen parent who arrived in the US with other immigration status had lower odds of EIT receipt compared to families with US-born citizen parents only. As seen in the second column, this association was significant even among Hispanic families likely to have EITC qualifying Social Security numbers. So in other words, even among Hispanic families that meet both the income and the Social Security number eligibility criteria, those that include immigrant parents are still less likely to receive the EITC. Next slide, please. Finally, we examined state level policies and practices that were hypothesized to be linked with higher rates of receipt. So we looked specifically at more generous state level benefits and refundability. We looked at legislation that required federal programs to inform participants or employers to inform employees about the EITC. We looked at the availability of government information about the EITC in Spanish. We looked at use of social media outreach and the accessibility of free tax preparation or VITA sites. Likely due, at least in part, to limited variability over time in these practices during the time period we examined. We did not see very many statistical associations between state practices in EITC participation, but there was one exception, and that was the provision of EITC information in Spanish, which was associated with 22% higher odds of receipt among all families. And I'll also note that we also saw a significant association in one of our state level controls, which we included to account for state level differences in receipt due to differences in the political climate of states vis-a-vis immigrants. So we found that residing in states that allowed driver's licenses for residents without US citizenship or documentation was associated with a 55% higher odds of receipt among Hispanic families. Next slide, please. Sorry, one more click, thank you. In sum, government anti-poverty programs are often based on the assumption that 100% of families will receive the benefits for which they're eligible, yet our findings show that this may not be true in practice, and especially for Hispanic families. To maximize the value of programs such as EITC and improving children's health and well-being, additional outreach and policy adjustments may be needed to boost awareness and ensure receipt among all eligible families, with a particular focus on those that include immigrant family members, or a parent who is self-employed, or a parent who has limited English proficiency. We recommend providing clear messaging in different languages, as well as other immigrant-friendly policies. And these may help ensure more equitable access to the EITC. In addition, increasing access to benefits for self-employed workers and tax non-filers may become increasingly important, as demonstrated through the policy response to the COVID pandemic. And thank you very much. I look forward to a great discussion.
Thank you very much. And we'll move to our final presentation, and we'll have some discussion time. Donna, over to you.
Thank you for allowing us to present our research. This is joint work with Michelle Johnson Moriyama at Ohio State University, and we're going to look at the association between state policies on access to TANF, child protective services involvement, and foster care. Next slide, please. So the paper examines how changes in state policies with respect to TANF are associated with increases in child abuse and neglect. And we use the state policy variation over time and instrumental variable methods, two-way fixed effects, and event studies to study these associations. Our outcome measures are from the National Child Abuse and Neglect Data System and include reports of child maltreatment, victims of maltreatment and for reasons of neglect, entry into foster care, victims entering foster care, neglected victims entering foster care. Now, the NCANS data system does not include information on some children placed into foster care for selected numbers of states. So we also included outcome data from the Adoption and Foster Care's Reporting and Analysis System, AFCARS, which had information on children placed into foster care because of maltreatment and children placed into foster care because of neglect. Next slide, please. Now, this is a map of TANF benefits for a family of 3 in 2016. The darker the blue, the more generous the benefits. Light colors in the Southeast show very low rates of TANF benefits. TANF, of course, was replaced aid to families with dependent children in 1996. It gave states the opportunity to have 60 months or fewer months of time limits on benefits, allowed states to impose sanctions for not working, allowed states to impose family caps, asset tests, and diversion payments. And it's basically a block grant the state can administer. In Kansas, a TANF payment maximum for a family of 3 is $429 a month. If you go to the next slide, the Deficit Reduction Act of 2005 put pressure on states to increase the number of TANF recipients who are moved into work. Many states, in response to this act, restricted access to TANF. And so we use those changes in policies from the Urban Institute's Welfare Rules database and created an index of restrictions. And these restrictions include the most severe sanction is the case closed, having less than 60 months for a time limit, insisting that mothers return to work if the child is less than a year old, no increase in the income earnings disregard, diversion payments for more than 6 months, and suspicion-based drug testing. In some states like Arizona and Kansas, time limits were reduced multiple times, and the map on the right shows states by the number of restrictions. And you see that Kansas is the darkest red. It has the most restrictions, followed by Arizona and Utah. Next slide, please. So our two-way fix, we have several different analyses in the paper, but I'm going to summarize the highlights in this figure. So anything with asterisks is statistically significant. And the blue bar is our main model, and our red bar is an all covariates model that includes controls for other factors that could have explained increases in child protective services and foster care, including the opioid epidemic, other safety net policies, and female imprisonment. And the main results show that once states imposed an additional restriction, they had between 44 to 50 per 100,000 children increase in neglect victims. Between 19 and 22 additional children placed into foster care after these restrictions were imposed. So 22 more victims into foster care from NCANs and AFCARs, very similar between 20 and 21. And if you look at neglect victims, and the majority of children engaging with child protective services are for reasons of neglect, you see 21 additional neglect victims in NCANs and between 19 and 21 in AFCARs. And next slide, please. We had staggered adoption of these policies across states and time. So we did an event study, and this looks at the percentage change in children placed into foster care as a function of relative time. So the negative numbers are before the policy change. 0 is when the policy changed, and the positive numbers are the years after restrictions were placed on foster care. And you see, starting in year 0, before the policy change in year 0, cases, children placed into foster care were trending downwards. And then at 0, you see an increase in neglect victims in all victims, up to 20% within 2 years of the policy change. We extrapolated our results, and we estimate that if you ease TANF restrictions, so doing the opposite of what we've shown here, it could have resulted in about 29,000 fewer children being placed into foster care. So if you go to the next slide, I'm going to thank you, but I'm going to talk a little bit about our policy implications. Obviously, these TANF restrictions are associated with increases in child maltreatment and as well as foster care placements. And the cost of placing a child into foster care is much higher than the cost of providing the small amounts of money provided by TANF. So states should examine these policies and their association with foster care. Thank you.
Okay, thanks to all of our presenters. We're going to move into a period of some discussion, and what I'd like to do is begin with some more targeted questions and then maybe open up to some themes that emerged from the first panel that we had that set the stage. So I'm going to go sort of in order of the presentations, although there's some groupings here that might change things around. But let me start, Kes, with you presenting as someone who's myself who's been very interested in the effective marginal tax rate of benefits phasing out. It is at some level gratifying to learn that the economic theory here doesn't play out exactly as it works for families. But I do wonder, presumably the implication isn't that we should ignore these benefit deserts or cliffs or whatever term we want to use, high effective marginal tax rates. So how do we take advantage of the reality that families are making very nuanced decisions when we have programs that are tied to, that are going to be available only when incomes are lower? How do we take the lessons from your work and use it to think differently, perhaps, about how we structure some of these programs?
That's a pretty challenging question.
I know, I'm sorry. I'm known for asking big
yeah,
questions.
But I think it is, I think connecting to what the first panel discussed about, we really need to review the social contract. I mean, I think we maybe many of us on this call, if not all, agree that these systems were set up in a very particular way to exclude many people from well-being, and to actively harm families, particularly poor Black and immigrant families. So, you know, I think fundamentally by, I think one of the things we were trying to do in our paper is acknowledge that, yes, people are losing benefits, but the solution to that, or the reaction, should not be, let's not support improving labor equality and increasing the minimum wage and getting rid of tipped employment and all of the other nationwide and local efforts to address just the really low incomes that a lot of people are coping with. Instead, maybe the lesson could be, as you're pointing to, how do we alleviate, how could we change our public benefit system potentially, or maybe other related systems like the healthcare system, to improve access to these really necessary services that end up increasing family income, or at least cash on hand, by reducing costs in other places. So I think some of the points from the first panel about what are the pandemic period responses that could be or could have been maintained, like more access to food, et cetera, to try to just, through other creative ways on the ground, increase cash on hand, while at a bigger level, we continue to advocate for significant policy transformation and system change.
That's great. And just so you don't feel left out, I'm going to ask an equally challenging question to Rita, and I think I'll bring in Dana as well, because you both were looking at the EITC. So as someone who's looked at social policy for a long time, we often were jealous of the EITC for having relatively simple eligibility rules, an application process tied to a tax return that many people fill out anyway. I understand not everyone, but you compare that to going to a county social services office to get TANF or AFDC or child care assistance, and so from the community I was a part of, we were kind of jealous, and your findings suggest maybe that we shouldn't have been quite so much so. My question to the two of you is, you both reference education and outreach, and I wonder if there's a more systemic approach to increasing participation in this program than education, which clearly could have a positive effect, but probably would also hit some sort of upper bound. Is there a way that we could get this benefit to a larger share of people? Sorry for such a long question, but the EITC has also been favored by being having relatively positive bipartisan support, because it's considered a work support program. I know, again, there are limits to that bipartisan support, but the general concept is, we want people who are eligible to get this because they're working. So could we see the next version of EITC with a higher level of uptake, not just from education? Cass, I told you I'd ask them a hard one too. So. Rita, you want to start us out?
Sure, I can start off. And yeah, I mean, I would add to that the EITC is generally thought of as like one of the less stigmatized benefits, because people get it by filing taxes, which theoretically everybody could be doing. And there's not these hoops of having to show up in person and do anything more than your average person would be doing. Although there is something more to do, which is this additional part of your taxes, which, I think not just our study, but others are starting to suggest that this is complicated, especially for people who are younger, like in our study, or lower income and aren't required to file their taxes just because they don't owe a lot. Or, again, people who don't speak English as a primary language. And so I think our study suggests lots of ways that, all of these things are things that more education would not necessarily solve. Let's take, for an example, the issue about, language, that, the IRS forms are only available, not in a lot of languages. And again, even Spanish, which is available, our Spanish speaking participants still had lower EITC take up. Clearly, that's not enough. And then again, sort of the lack of availability of enough free tax filing services. I think, there's potentially a lot more to be done in terms of doing sort of systematic things at the government level to provide that more for participants. Again, like more free filing services for these very low income people who are eligible for them, but not taking them up, and then doing it in multiple languages. Those are just examples. And just one quick thing about the confusingness of the eligibility requirements. So one of the requirements is that if you're under 25, if you don't have kids, you're not eligible for the EITC. And if you do have kids, you are eligible for the EITC. And I was actually talking about our results with another person who studies the EITC, and they're like, oh, of course you found that people under 25 won't receive it. It's because they're not eligible. And I'm like, but they all had kids. And if you go look at all the websites out there that sort of are supposed to be helping people with their EITC claiming, many of them don't have that requirement. So it might be that a lot of people under age 25 think they're ineligible because of their age, just because of, like, again, these major tax filing assistance platforms are not clear on that very basic requirement, because it is confusing in that way. So I'll stop there and let Dana jump in as well.
Great, thanks.
I agree with everything Rita just said. And I love the question of, are there systemic ways for us to increase uptake? I would say the biggest way to increase uptake would just be to make the credit automatic when we file taxes. I actually was, after the death of my husband, was eligible for the EITC, had no awareness of it, and received a letter from the IRS that said, did you know about this credit? We've actually automatically applied it to this year's tax return, and you should apply for it in following years. That was part of an experimental process that the IRS underwent during that particular year. But wouldn't it be great if we did that for everybody who was eligible, just automatically apply it? I think the second thing that we want to think about is non-tax filers. So as everybody's probably aware, we opened a non-tax filer portal for access to the expanded child tax credit. So thinking about doing something like that for the EITC as well is another really important way to make sure we're reaching the families most in need. And then the last thing I'll say is there are also community-based ways to increase access in a more systemic way. So there's a program out of Boston Medical Center actually called Street Cred, and it's run through community-based health clinics that actually file taxes for families. It's out of the pediatric clinic. So for families with children, right there while they're waiting for their doctor's appointments. And one of the benefits of that is there's this trusted person, this pediatrician that families know and have a relationship with. So it's a really powerful program for reaching families that may otherwise not be aware of the credit, and being able to scale something like that to health clinics throughout the country is also a powerful way to do that.
Great, love those answers. Thank you. Really thoughtful approaches, both of you. Let me bring in Sunya, who the findings you presented are powerful and really, to me, quite disheartening on the very high rates of sanction for Black women. Because you had a lot to cover, and because it's such a complicated topic, I want to make sure our listeners understand the cooperation requirements associated with child support enforcement. You gave a really clear description of sort of the solution to the problem, but I think if you haven't studied it before, people might not even be aware of the origins of the problem. And so could you just say a little bit more about what the relationship is between TANF receipt and child support enforcement, both from on the cooperation side and then on the benefit side?
Sure. As part of receiving TANF, a customer must also go through the child compliance rules. So they need to identify the father of their children. So there's court proceedings, there's blood tests that are done to identify so that the state in Illinois can get the child support. And when that child support comes in, usually the state gets most of it, gets a chunk of it. For each child, I think for one child, it's 100, for two child, it's 200. But majority of that child support actually does not go to the TANF customer. It ends up going to the state to actually fund the administration of the TANF program. That's what happens when the child support comes in. But as part of getting the TANF grant, a customer needs to go through those requirements of identifying the non-custodial father parent and getting that information.
And so just to be clear, when custodial parents say that the total resources available to my child are actually lower when I cooperate, it's because those dollars are taken from the non-custodial parent and then kept by the state instead of a good share of them instead of being passed on to the custodial parent. So the collective resources of the two parents to support the child actually go down through cooperation, which is why you made the policy suggestion you did. I wanted to walk through that because it's a bit arcane, but the sanction rates are so high. It's a central feature of these programs. So I appreciate you explaining how that works. And let me just bring Donna in also. So you're also looking at TANF, and I guess we only have a little bit of time left, but I'd like to sort of turn to the entire panel, starting with you, Donna, maybe going back to you, Sonia, because of the racial focus of the first panel and of the findings thus far, to talk a little bit about sort of the racial and assumption aspects associated with these programs, that as our first panel described, that there are certain norms of behavior, there are certain expectations for children that are harder to attain if you're in poverty, not because of anything that you're doing wrong, but because you're in poverty. And to just sort of start to at least make sure as we finish the conversation today, we bring these back to these themes of equity. So Donna, I wonder if you could take sort of an equity lens on your work in addition to the question of child abuse and neglect. And then I'm going to sort of run back through the rest of you and ask you to do that before we close out.
Well, thank you for the opportunity. That's actually the next paper that Michelle and I are working on, is looking at the differential effects of placement into child abuse by race. And unfortunately, our results are showing that there are these race differences, right? Now, Sonia's paper is very interesting because she shows that, Black families are more likely to be sanctioned, right? But Illinois is a state that's actually very generous with TANF policies, right? So that's a situation where even though you get this disparate impact, they're providing more resources to low-income families than a state like Kansas. So, I mean, we're having unequal treatment, not only by race, but also across, where you happen to live. And kids can't pick where they're born, right? So these policies that restrict access to the social safety net are harming innocent children, is the takeaway and they have differential race effects.
Well, and it's also a reminder of the importance of not generalizing too much from one state's results on some of these programs where the administration policies can be quite differential. And I don't want to guess where Illinois would land if you were to do a spectrum around the country, not just in terms of the size of benefits, but in how programs are administered. But certainly there are many state and local practices that affect equity that are not going to be uncovered by doing a single site. And yet there's lots of insight into how things work that we're not going to get from national data. So we really do need both of them. Sonia, do you want to reflect a little bit more on this? It really was the heart of your paper.
Yeah, I think from our research and just from what we heard and the stories that we heard, that what the first panel said about deservedness, who gets support, who doesn't get support, what are ideas and norms of what a two-person family really influences who's getting this like limited scarce resources as it is. And if they don't meet those, there's sanctions that are applied. And there unfortunately, these families that don't have enough, and then you're sanctioning them on top of this based on these assumptions, and then they get reduced benefits. So, and it really just ultimately, like Donna was saying, impacts the children, and they end up having less supports to thrive.
I do think that the evidence shows that not counting child support towards income is beneficial for children, first of all. And second of all, some fathers may be dangerous to the mothers and to the children. So we need a more nuanced approach to providing child support.
I mean, like I said earlier, that they have the option of getting a good waiver, but just to get that waiver to have the non-custodial parent not identified is also very complicated because it requires a lot of legal and a lot of documentation and paperwork that sometimes mothers don't have access to, and they just then cannot provide it, and then they're sanctioned, and then they don't get TANF. Then they're also being penalized for not having that documentation.
Rita and Dana, in your work, in your response to my question, you definitely addressed some of the equity dimensions, although not so much racial. Linguistic certainly came up, there are relationships across these different domains. But I just wonder again if there are more thoughts you'd like to bring into the close that reflect back on the conversation of the first panel as we think about making sure these income support programs are as equitable as possible in promoting health.
I mean, one thing that I am thinking of is as you said, Alan, that one of the things that gives the EITC a lot of bipartisan support is that it's poverty reducing, but that it also has this work requirement so that it incentivizes employment. And one of the things that we saw during the pandemic is, and in general, but the pandemic really highlighted this, is that sometimes people are unemployed not by choice, but because of the labor market or illness or something else. And that like the other presenters have been talking about, the income supports for people who are unemployed are maybe not filling that gap. And that, during the pandemic, the people who disproportionately lost employment because they were in low-wage jobs or other features of structural racism were Black and Latinx populations. So that, moving forward, thinking about ways to perhaps expand either the generosity of the EITC on the lower end of the income spectrum for people who are having hard times getting employment or getting enough employment because of structural factors. And, similar to how the child tax credit was expanded during the pandemic, having an income support for people who are unemployed for whatever reason, so that the kids can still get that needed income support to thrive.
Great.
Yeah, I think both Rita and my work highlighted that there is unequal access by race and ethnicity. And that is even among families who are eligible for the credit. And part of that is program awareness. It's outreach, it's language barriers, it's also anti-immigration rhetoric and the chilling effect that has. And then there's also, which Rita just referred to, inequitable access due to the policy structures. And that's in part due to the way the EIT is set up to increase the benefits as income increases. And so families in the lower end of that income spectrum are receiving lower benefits amounts. The other policy angle is that families or children and families who include members that don't have a social security number are excluded from the benefit as well. And we know that 94% of Hispanic children are US citizens, but 1 in 4 live in a family that is mixed status.
Thank you. And Cass, I'm going to end with you. You had this incredible set of conversations with folks talking about the structure of the safety net and the economic incentives built into it. Can you map that back onto some of the discussion about race and assumptions and racism that started off our discussion today?
Yes, I mean, my larger body of work really looks at this issue of deservedness and how it is communicated to low-paid workers. And it certainly came through as well in this study. And you know, we asked parents in the final questions of the interview process about what recommendations they have directly for policymakers. You know, and one of them is about rebuilding trust. I think that's like a trend through them, that we need to trust families that they are trying to care for themselves, their children, their communities, and they are showing up for their end of the social contract. And yet, because of racism, because of assumptions about appropriateness of certain family structures, heteronormativity, and certainly sexism and I'm forgetting the word for sort of being against poor people and very suspicious of poor people, that we build policies that communicate that distrust and punish people for really just trying their best to live in the system that is designed to punish them. And so I think, you know, one of their big recommendations is just let us have access to the things that we need and trust that if we need it, we need it. And I think that, you know, for all of us on this call, this is something that we can do at multiple levels. Certainly federal government, state governments can do better to trust constituents that they're going to reliably and authentically, in large part, use these benefits. But these are coming through. These are problems also in community policy and practice, workplace policy and practice. We're reinforcing this concept of deservedness and punishment in many, many systems. So I think all of us work and live in communities and systems that we can start already making change in our own workplace, in our own community, to say, we trust you, we want to show up for you, we want to eliminate barriers. And I think the pandemic really showed us that we can do that much more quickly if we want to. And I hope that this research helps to say, we need to do this. It is urgent for the health and well-being of families and children.
Great. Well, thank you all for those closing thoughts that really tie these two panels together. Thank you for your research and submitting it to us for publication. We're honored to have been able to do so. To the audience, please do take a look at the scholarship published in the December issue of Health Affairs, which includes these papers as well as some others. Our thanks also to the Robert Wood Johnson Foundation. They funded the research here, but they also funded our ability to publish and present and have a session like this today. If you've enjoyed this sort of content, we hope you'll join us again for other events coming up in the future. On Monday, December 12th, just this coming Monday at 3 o'clock Eastern, I'll be just having a conversation with Dr. Ashish Jha, who's the COVID-19 response coordinator in the White House for the Biden administration. On Thursday of next week at 4 o'clock, we'll be having a journal club where one of our authors, Leah Fernald, will talk about the take-up of the Earned Income Tax Credit. I will note that the journal club is one of a series of events we hold that are limited only to Health Affairs Insiders. Health Affairs Insider is a membership program that offers access to content beyond the journal. And supporting us through Insider makes it possible for us to continue free availability of events and publications, including our very popular and widely read Forefront publication. So with thanks again to our speakers, to our audience for submitting some questions, to the Foundation for supporting the work presented here. We appreciate you being with us today. And with that, we are adjourned.